1 minute on spondylolisthesis, right? Because I'm getting a lot of DMs on social media. Spondylolisthesis, right? And we're usually seeing this in the lumbar spine, right? So normal lumbar spine, right? You're going to have the bones, and you're going to have the tailbone, right? The sacrum, and they're lined up. Well, a spondylolisthesis is when these bones are shifted, right? And so here we have the spinal canal behind this. So what happens if this shifts, right? So then we're going to go like this, and we're going to go over like this, and we're going to go over like this. So now you have the bones, and then this bone is shifted over here, and you have the tailbone, right? And so then your spinal canal is going to get really pinched over here, right? And so what we're telling people is just because you have a spondylolisthesis doesn't mean you necessarily have to have a fusion or a major reconstructive procedure with rods and screws, right? And so I want you to think about the leaning tower of Pisa, right? And I want you to think about, is it Jenga? Jenga, right? Right? So in Jenga, right, you know, you're stacking all these blocks up, right? And then the object of the game is to slip in and pull this block out without knocking down the whole tower, right? And so it requires skill and precision, which is what are the hallmarks of endoscopic spine surgery, right? So nobody gets a spondylolisthesis operated for cosmetic reasons, right? They get it because they have pain. So what we're able to do with endoscopic spine surgery is we're able to slip in with a tube the size of a number 2 pencil and go in and unpinch the nerves in the spinal canal without having to do a major reconstructive procedure with rods and screws. So if somebody is stable, meaning on flexion extension, they're not moving, you don't have to have a fusion. We can treat that endoscopically, right? So if somebody's unstable, right, you're going to have a fusion. If you're in a car accident, you have instability, right? You don't necessarily need a fusion just because you have spondylolisthesis.
Can I see something? So what you're saying is if you have a cylinder like this, and that's your spinal canal, and your nerves are going through there, and that's in a normal spine, and let's say these are 2 pieces. If one is shifted here, just like this, that means your spinal cord is compressed because that has now shifted. Is that what you're saying?
That's exactly what I'm saying, right? And so rather than, you know, doing a major highway reconstruction, right? You're just going to open up another lane, right, on the highway, right?
Got it.
And let the cars, like, you're going to let them drive down the breakdown lane, right? You're not going to block the highway for a 2-year reconstruction project, right? Just because one of the lanes is blocked, right? We just go in there with our scope and we just do a little roto-rooter, shave a little extra room so the nerves can get by.
So you unroof that.
That's it.
Genius.